Welcome back to part 2 of our episode series on menopause and
Look at us doing
perimenopause.
a two-party.
Welcome back. It's because we're so long-winded.
We are.
I talk so
We can talk
much.
about anything.
So much yapping.
We do. In fact, if people heard us before and after what we talk about,
Well, how many times we're talking and you're like, we should have been recording this. We should have been recording
we'll do
this.
that. But it takes us so long to get this stuff in check.
I
that-
know.
Yeah. So,
I know. It's the brain fog. It's not our fault. It's not our fault.
all right. So we're back on our perimenopause explanation of what it feels like, what it is, how we're navigating through it, how to advocate for yourself. And our first section, we talked about kind of what it is, how it feels. And we talked about common side effects that people discuss and often can kind of commiserate about together. But there are also ones that are not necessarily uncommon, but maybe not, maybe unspoken is a better word. We don't talk about these as often. And I don't think your providers talk about them as often either. And since we are going through said things, we thought this was an appropriate time to explain. All right, so I had this one personally, and this is what ruined my relationship with caffeine.
Oh.
So decaf coffee and I have become friends. I mean,
Oh,
we're
really?
like,
Did you drink decaf today?
I
Oh.
wouldn't say we're friends.
Oh, if I was decaf, I'd be like, I'm not doing it.
You know what? I thought I could not do it, but I need it. I just need that part. I think
The taste?
it's my, you can't take everything from me, damn it.
Oh, I call that, yeah, like when people are getting sober, I call it the last act of rebellion. Cigarettes.
Yeah.
Every time.
Yeah.
Every
yes,
time.
Yeah. Always.
Yep.
Always. Yeah. So the heart palpitations, this is something that I think freaks a lot of women out.
Yeah.
Because it isn't something that you're told. You start to think, oh my God, there's something wrong with my heart. I can feel it. I can feel it skipping a beat. I can feel it maybe sometimes doing a double beat. You start to think it's got to be anxiety. Am I having an anxiety or panic attack? But actually, it's extremely common. And again, I will not go into the chemical reactions because I am not an expert and do not know them very well. But I do know that estrogen has a particular component to it that works with the cardiovascular system, and that having these heart palpitations is a side effect of perimenopause.
Yes.
So if you have them, I have had them. They stink. They're not fun. And one of the things that you can do to subside them often is decrease your caffeine intake because that can actually bump them up a little bit. So yeah, welcome to the world of decaf. I mean, it's livable. You have to go here. Don't look at me like that.
Oh, I am.
Not only can you have sensitivity to caffeine at this point, but let's go for your other one. You have sensitivity to alcohol now. So for those of you that are waking up constantly after you drink, you are more anxious than you were before ever, or you just feel worse. You're like,
I
what
think that's
happened?
an age thing too for people.
Yeah,
You
for
know what I
women,
mean?
it hits differently because when you talk to men do not necessarily say as much. Like,
Oh, okay.
women will
Yeah, you're right.
often-
Yeah.
women will often say, like, man, I just had like a glass or two of wine, and now I feel awful the next morning. I feel like, where men still might say that if they drink several drinks, but women will often describe it as, I literally just had like one, or I had like 2 glasses of wine, which typically is not going to do anything for me. And they feel awful the next day, really fatigued, really tired, a little more anxious. Where they would feel like that would be how they would felt if they had over drank or had way too much. So sensitivity to alcohol is, yeah, I mean, it's coming after every one of our vices. Everyone. Sucks. We talked a little bit about this in the last podcast episode, but the irregular sleep pattern. And providers are a little funny about that because irregular sleep patterns can come as you get older as well. Any point in your life, really, but definitely as you get older. But I think women feel like we're going in the opposite direction. So we're up. I joke all the time, like I'm up as if I am, 36 weeks pregnant. I'm up like every 2 hours. I'm waking up and then I always have to go to the bathroom after I wake up, but it's not what wakes me up. What wakes me up is I just can't sleep. I'm up 2 hours. I'm awake. So I'm like, yeah, I'll go to the bathroom, try to get back into bed, read a little bit, try to go back to sleep. So it's this kind of game you play all night long with your sleep pattern.
I feel like the amount of things that I need to like go to sleep have increased
Oh, yes.
drastically.
Well, because it's temperature now. It's got to be cold.
Yep. So I have a fan. My husband did buy me a chili pad because I
Okay.
sweat in the night. Those are, if you can swing it, highly
Didn't you say they were
recommend.
expensive? Because I
They are,
think I looked in that and I was like, damn, that is not
yes,
on the
they
list of
are
things I
very
need to get.
expensive. But it's like this very thin mattress pad with very, very thin tubing that connects to this little like reservoir, and you fill it with water and set the temperature. So you can set it really cold, or you can set it medium, or you can set it warm. And it just keeps the water flowing through the tubes.
It's like sleeping on an air conditioning.
It is. I had the best night of my sleep the first night I used it. Best night of my sleep
Hey,
ever. So we got the fan, we got the chili pad, we got a sound machine. Yeah. We've got pillow spray.
traveling's going to be difficult for you, girl.
I tell you, I was just at the beach. It is the worst night of my sleep.
You're like, damn it, I don't have any of my
Also,
things.
the bed upstairs, for some reason,
Mhm.
every time you moved on it, whoever was up at
Yeah.
I was ready to murder someone. Like,
Yeah.
it was really bad. But so we got the fan, we got the chili pad, we got the bed spray, the sound machine. I've got lavender lip mask. Yep. I was having an eye mask. We have gotten rid of the eye mask, but
Okay.
that was standard.
Okay.
The one that's hardest for me, particularly when traveling, is my weighted blanket.
Oh, that is problematic.
Yeah, because you can't take it because it weighs like 15 pounds.
Yeah.
But of all the things I need that one the most. And I've had this one for a really long time. You know, it's got like the squares, so all little beads kind of stay in their square.
Yes.
But since I've had it for so long, the beads are kind of all going in one
Place,
corner.
yes.
So the other night I was like moving and it's all in one corner, and it was like a fucking cornhole bag smacked me in the face. I feel like sometimes my only exercise is like thrashing with anxiety underneath my weighted blanket. I'm like working up a sweat doing that.
Well, okay, I don't think I could have a weighted blanket because of the heat.
Oh no, I've got it's like I got one leg sticking out, one leg half. It's like sometimes half the blanket's on just my
They
upper
make
body.
a cooling weighted blanket.
I don't know, but I bet they do.
Listening.
But that would be great.
Perimenopausal, menopausal women out there. If you could make a cooling weighted, weighted, it could be weighted, a cooling weighted blanket, I would, and I will try that for you. I will view it.
But I love my weighted
Yeah.
blanket.
All right.
Yeah, but just really, yeah, you can't.
You're not an easy travel.
Well, I once recently in the last year when I was in Portugal, my roommate who does listen to this podcast, she's lovely. I love her. Yes, thank you. And she knows that she snores.
Oh,
Do you know where I slept the one night we shared a room?
where?
The bathtub.
Ooh,
In the bathtub. I slept in the bathtub.
I haven't done that.
I tried the white noise. I tried the headphones. I tried earplugs on top of the headphones. I think I'm a very sensitive sleeper as well. And I didn't have all my accoutrements.
Okay.
So,
Do you want to know what's terrible? This is how I sleep. I don't have any of those things.
okay.
But my poor husband's like, it's like sleeping next to a linebacker. So I go in to the bathroom, right? Brush my teeth, wash my face, do all my things. I come out. I've got like, so I've got this kind of hair, right? So I have a silk bonnet that I wear at night. I have, take my contacts out, my glasses on, and I refuse to spend money on glasses that I only sleep in. So they're literally the thickest rimmed glasses. They look like they're from 1980. And I grind my teeth terribly.
The old night guard?
So I have but I don't even have like a professional dentist grade night. I have like the ones you get from Amazon, which is really for sports. Like they're the big ass ones that you just shape when you boil them to your teeth. So yeah, I come out of there, my hair's pulled back in this bonnet that's like tied to the top.
That is a sight to behold. I'll tell you what. Yeah. The two of us traveling. Whoo.
Yeah, we would see something.
Mm.
All right. Some other unspoken symptoms of perimenopause and menopause is swelling of the joints.
Oh, yes.
Yeah, swelling of the hands,
Mhm.
your areas around your knuckles, your knees will hurt more. You will feel like your knees are kind of feeling swollen or hot or hurt more. So you will have those particular things that are also a part of the hormonal changes that are going on, but not something that we frequently talk about.
I think another joint that really gets overlooked, that can cause a lot of people problems, like lower back problems, is your sacroiliac joint, so your SI joint. So you have a joint at the bottom of your pelvis.
Oh, okay.
That is, in fact, a joint.
Zaps me every once in a while.
It could be. It's not a ball and socket, but it is a joint. So if there's inflammation there, that can give you back pain.
Yeah. I think you'll start to wake up and just feel kind of like, especially in the morning, if you get the swelling of the joints, your fingers will feel like they're swollen. Like,
Can't get your rings off.
yeah, yep, yeah, all those things. So absolutely common. Here's another one that does not talked about often, but women will speak about it now pretty frequently when I talk about it, is clearing of the throat or sinus issues. So there is another hormonal change that's going on where there's particular linings that are getting a little thicker in the sinuses. So you'll have more stuffiness,
Mm.
almost feel like allergies a little bit more than you've ever had before in your life, but that's related to this particular time. And to that point with stuffiness, there is a clearing of the throat that actually occurs a bit more
Mm.
with women in this stage. So yeah, but that's something that people don't talk about, but you'll talk to women and they'll be like, yeah, I do that.
Mm-hmm.
That's why.
Yeah, I feel like I must have like broken my nose at some point in my life because if I do this,
Mhm.
I can breathe normally,
But if you don't do that, you can't breathe.
not out of this nostril.
Deviated
You can if you feel right here on the bridge of my nose, it's very slight, but you can feel where it's like right there.
Okay.
That's on my list. No,
Oh, you should.
it's on my
Okay, it's
list.
on the list. We're gonna get it done. That's fine. Chronic cough.
Oh
This one I
yeah,
did not know about because I have not experienced the chronic cough, but I have asthma, so we always
I don't
cough.
have the chronic cough, but definitely the throat clearing, and you can hear my voice. And this happens at
I do
work
all the time.
a lot. And I thought it was like, oh, it's, I've been talking all day. It's the end of sessions, but you can hear it in my voice right now
Yeah.
where it just starts to go and it feels like there's something.
Oh yeah. And I do that all the time, and then it drives me crazy that I'm doing that all the time.
I know.
Oh, it's so annoying. We should go to the ENT
Together?
Probably give us something.
We can record ourselves. It'll be a vlog, guys.
We're gonna both end up out of there with CPAPs. Like you with the night guard, you need the CPAP.
You also need a CPAP.
With a deviated septum.
Yep, you need a surgery. Mm-hmm.
We're their dream.
Mm-hmm.
Tingling sensation, and not the good kind. This is like having feelings of tingling in arms and legs.
Oh.
Yeah.
I always thought that was a ghost.
Oh. I wear so much.
I thought I was being like haunted.
No, yeah, the tingling sensation where you just feel like
oh, it's just menopause. Oh,
just
dang! I thought it was like Casper the Friendly. No, all right.
no increase in migraines, which
yes,
is often talked about, but migraines have so many layers to them that I think that gets confusing for some people because some people will get some of the symptoms of like the occipital migraine, which is when we say that it's like you get this like broken vision for a little bit and it's very kind of wonky and it will feel a little off for a while. But sometimes that's not exactly followed by the headache or severe migraine. So you start to think that it's something else with your vision. But those are pretty common. And those will continue as you go through perimenopause and into menopause. Dry skin, like extra dry skin. That part sucks too.
Yeah.
Because we're trying to take good care of your skin as the years gone, but like this is like extra dry. Like
yeah,
I get out of the shower sometimes. I'm like, my skin like hurts. I'm like, that was like I need
to use like oil. No, cream is not enough.
The Vaseline just shoot me down.
No, seriously, it's like not enough anymore.
I hear you.
Yeah.
Yep. I know. Dry skin, awful. Itchy skin too.
Look, you see the nail marks in my skin. Do you see it? That's how dry it is.
Itchy,
but dry, itchy. Right here.
We got every
right here
on here. Frequent urinations, which we talked about a little bit in terms of sleeping, and increase in UTIs.
Oh, okay. Well, yeah, that makes sense.
Yeah, unfortunate. And be careful of those because they could be really wicked if left untreated.
They can turn into a kidney infection. It is not a good time. You can end up in the hospital.
Here's one. Changes in body odor. They don't necessarily mean like the body odor, like when you smell when you're like sweating or you've had like a big run or something like that. They just mean like if you had a particular scent for years, like just
your effervescence of you is different.
That's changing.
Your ODU. Now it goes from ODU to ODU. See how good that was? That was like,
great.
Come on.
You're on today.
I know. Listen, girl, I am on one.
Own it. Own it.
I am on one.
It's my day.
I don't know if it's my day. It feels like it's really not my day.
But maybe
it's
that's
not my
thing.
week, not your year, or even your turn.
When it's not your day, you're funny. Then take it. I mean, take it.
You know, it's funny. My dad said to me, I guess he does listen to the podcast, but he said to me, I saw him.
I love your dad.
I know. He must listen to some of it. But he said to me, I don't know, because, my life's a dumpster fire right now. And he goes, you sound so happy. And so I don't like, how do you do that? You really like what you do? I go, yep. And I said, it's a lot of denial. It's a lot of denial.
Was
So
that stupid
much.
for a while? We just
Yeah.
forget about
You forget the
real life,
dumpster fire.
right? Like,
Yeah.
and that's the whole point.
Yeah.
We are not normal, but we're nearly.
Mhm.
Like, for a couple minutes here, we are nearly normal. And
This is
so
as close as we get to normal,
that's right.
I think, for me.
And people can watch that. They're
Mhm.
like, look, those people are kind of crazy and they're therapists.
Mhm.
But for a couple minutes, they're nearly normal. Like,
Mhm.
yeah, that's the whole point. So join
Mhm.
us, be on that journey with us. Welcome.
Yes.
All right. So we smell now, apparently. We got that.
Mhm.
I talked about allergies. This one's, I did not have this, and
On your bingo
love to
card?
hear from somebody who had this. Yeah. So I have had one part of it. I haven't had the first. The first part is a feeling of your tongue like burning, like being
Nope.
hot or burning. I have not had that,
Nope.
but I've had the change of taste. Um, we've talked before how nobody should have red dye banned more than I because of my affection to candy and all things gummy related. And I cannot have anything sour anymore.
Oh,
And I
interesting.
like lived on that shit.
No.
Yeah. So I eat a Sour Patch Kid and I'm like, oh my God, I can't do it.
It's funny you say that because the other day, what were we eating? I think it was like, it was a grape. And it's like, my stepkids were there and we're eating these grapes. They were crispy, green grapes. And I bit into one and I was like, ooh, that one got me right back
Yes.
here. And everyone was looking at me like, what? And I was like, ooh, yeah, the sour, that one just got me right back here. Looking at me like I was nuts.
Okay.
No one else experienced it, but I was like, I had another grape and I didn't get that. So maybe it was the grape, but it could have been me.
Can't eat a crisp grape though.
I can't rule it
That's
out.
amazing.
It really was.
Like,
That's why it was like,
but yeah, maybe it's a
it
sour
almost
thing.
makes a crunch when you bite into it. Oh, so good.
Love it. But yeah, we'll have to figure out if I'll have to ask.
Maybe we'll do
this
some
week
taste testing.
Yeah. Oh,
I have some sour candies.
get our awful reaction to it. Like I can't. Yeah. And I'm sad because I do love all that crap that I shouldn't love. Allergies get worse. We talked a little bit about that. And dizziness and balance issues.
Yes.
Yeah.
I also get it's another reason to go to an ENT, and it may or may not be related, but ringing in my ears happens.
Oh, the tinnitus.
Yep, very frequently. Yeah, yeah. Oh no, I get it at least once a day, and it could be when I'm sitting.
Oh.
Okay. But sometimes when I stand up, it's like I just had it like just now when I just had that going like this. But I have like orthostatic hypotension. Okay. So when you stand up, your blood pressure plummets. So when your blood pressure is low, your balance is not great. But I think in general, even outside of that, my balance is just, like in the night, I'm banging into the walls, and it's dark. It could be, but I think also part of the problem is me. Unanimously, I think part of the problem is always me in these like
with perimenopause on this one. It's the perimenopause.
Okay.
It's perimenopause. We're
okay.
going to say it's everything. I have some rare symptoms. So I sussed out some really rare symptoms that people state, which I have not had any of these, and I'm hoping not to get these, but if you get them, we want you to know it is nearly normal for the perimenopausal stuff.
Okay.
Feeling this would send me over the edge. I would be locked away if this occurred. I'd run out of my house screaming. Feeling of bugs crawling on you. And what they mean by this is you're legitimately going like this, like on your skin, like it feels like something's underneath your skin, like crawling.
I haven't had that. I have had restless leg syndrome, and if people are like, and they blow it off, no.
With a weighted blanket, that one.
Yeah, no. If you legitimately have restless leg syndrome, which you can get from like iron deficiency, it can be a symptom of iron deficiency. Yes. It is horrific, and it happens at night. It's awful.
Before I got on my iron supplement,
I'm on an iron supplement. I have one of those pill containers.
No supplements for on. It would be like a 20-page.
No, I have the pill, the Sunday through Saturday pill, and I had to just get a larger container. Yeah, because the pills are now so large. They're so big. The one you almost choke swallowing them. You're like,
I get gummies in almost all my supplements. Like, I'm so immature. I'm like, listen, if I have to take yet another pill, we're going to go with a gummy on these.
I'm like a wackadoodle. People always look at me crazy. I'll have like...
You do the handful?
Yeah, I'll have like 10 in my hand. I throw them all in my mouth.
I'm impressed with that. Seriously. Don't choke.
And I'm like, down the hatch.
Meanwhile, I look like a 12-year-old. I'm like, here's my gummy B12. Here's my gummy magnesium.
But my problem with my approach sometimes is like, wait, Was that one in there? Did I take that
Oh,
one?
I do that with
Right.
everything.
Vitamin
Brain,
C, that's not a problem. But like your antidepressants, that might not
right?
be
You
great.
can't double up
Like,
on this today.
yeah, I don't
That's a
know.
bad idea.
I don't know.
Um, shoot, I was gonna say something else about that. About the
Did you just have brain fog and forget? Damn it.
time. Oh, the restless leg. Before I got on my iron supplement, my husband used to say that I would just pick a whole leg up and then boom to the like bed with it.
In your sleep?
In my sleep. Like my leg would just go
Oh,
up and then down, up and then down. And he's
girl,
like, you'll shake the whole bed with this leg, and I'm completely out. Don't know I'm doing it.
you need an ENT, a sleep study. Just add it to the list. We'll do a vlog
A
of
cooling
weighted
blanket
blanket.
if it is out there. All right. Next rare symptom is feeling bolts or zaps, and they can often come before a hot flash, which would make it even worse. So, yeah, feeling like those. You ever have like the our world is antidepressants and such, so we know that antidepressants can cause those what our clients often calls like brain zaps, which is just like this feeling of. It is the best way to describe it as like a
I
zap.
don't think I've ever experienced
Yeah,
that.
I've never had that, so hoping not.
The zips or the zaps?
Hmm. And then finally, tooth pain or gum issues. Gum issues will increase because of the estrogen issues. So estrogen's also attacking apparently your tooth health. Your
You
gum
gonna have a
health.
busted grill?
What?
Girl, you can't have a busted grill.
I wear that night.
This is always what I say. If something happens to my teeth, I will not have a busted grill.
No.
Like I would be living out of my car to pay for my teeth.
Yeah.
Like
Did you
I
ever
can't.
chip a tooth? Like I chipped my whole front tooth. Like half my front tooth is fake.
No. That's
Chipped it right off.
interesting.
Yeah.
That's interesting.
And it is awful while you wait for it to be fixed. Like you just like try to keep that lip down so you don't smile. It's awful.
Nobody look.
No.
Don't look behind the curtain. Yeah, I think I told you the story, but I'll retell our listeners. Yeah, I hadn't been to the dentist because of like COVID, whatever. So it had been, I think, like maybe 2 years that I hadn't been to the dentist. And I am not one of those people that is afraid of the dentist. I go and I'm like, tune her up.
I can sit there forever.
Yeah, I have no problem.
All right.
No problem. Like do whatever you must. And so I go and yeah,
I can't answer you.
but I had like tooth pain and I was like, oh, I probably have a root canal or something, some crazy thing that I've never experienced. I was like, yeah, it must be that. They're going to pull a tooth. Um, and the dentist checks my teeth and is like, all right, you're good to go. I was like, excuse me? He's like, good to go. Say it again, sir. Good to go. Never in my life have I gone to the dentist and they have been good to go.
I thought you said you had tooth pain though.
I did have tooth pain.
Okay.
Yeah. And I have like soft teeth and, whatever that is in my tilted uterus and all those things, right? That they're like, meh.
Your restless leg.
So I was like, really? I could have sworn I had a cavity. It's like, no. I was like, wow. And that just reinforces my like terrible, dental hygiene of like, do you floss every day? Absolutely. No. I've never met a person that flosses every day.
Me neither.
I floss the day before the dentist.
And then they say, why are you all red?
Yeah, they're like, why are your gums inflamed? We know what you did.
My sister-in-law is a dental hygienist.
Oh.
She's so great about obviously her teeth and then like talking to my kids about like good teeth health. And she would be appalled to know that we do not flush.
Yeah.
We don't flush.
I hope you flush. And I hope you floss.
We do not floss.
Yes. Yes.
floss.
But so the dentist was like, to be honest, so I'm all hyped thinking like, it finally happened, not a cavity to be found. He was like, well, most of the surface area of your teeth is full of white composite. So, because I've had so many.
Oh, I was like, so is he going to take that off? Like,
no. And you can get them between your teeth, but there's so much white composite in my mouth from all of the cavities that I have had that it's basically, I don't know how much actual like dental enamel.
So what I'm hearing is like you have an A+ for the rest of your life now.
That's what I say. I was like, okay, aye.
Yes, bring it on.
Yes.
Jawbreaker? Absolutely. Some Jolly Ranchers?
Yeah. And then I told you, he gave me the highlight of the day. He was like, you use Crest White Strips? I was like, no, I don't. He was like, really? I was like, no. He thought I whitened them. He was like, oh, okay, your teeth are really white. If a dentist is telling you that, and an old dentist,
okay,
and he's seen some teeth, I'll take it, sir.
Hey, that's a gold star.
I'll take it. Thank you.
There you go. Your teeth are not going downhill with perimenopause. So
nope.
There you go.
I will not have a busted grill.
You will not have a busted grill. All right. Health implications for this. We've got increased risk of osteoporosis. So
Mm-hmm.
your bone health, because estrogen is a huge part in bone health. So we've got to watch out for women, and you got to make sure you are getting those bone scans when you hit a particular age. They'll start to atrophy.
I've already had a DEXA
Yeah. How was it?
scan. It was fine. You just lay there.
Yeah.
Yeah, it was no big deal. They were like, "Yeah, you have early osteoporosis." I was like,
I
"Tell
mean,
me
yeah.
something
You're
I
like,
don't know." But I got it when I was like 31, I think.
okay,
Yeah,
you were early on that.
many things. Yeah. They're like, "Pff, you are not normal."
Nearly. You're nearly. We're just shooting for the
Same thing,
mark.
mammograms. Same thing.
Oh, the mammoth.
Yeah, I've been getting those since I was like 33, 34.
And who doesn't ever get the letter about dense breast tissue? Like,
I have not met a person that
right?
does
Who
not have
doesn't
that.
get that letter? So can we just stop with the letter, because it's when are we just going to catch up the research that says, oh, every woman
Hmm.
every woman has dense breast tissue, so
Hmm.
it's not a rarity. We don't need to send you a letter. You all have it. So then let's just move to the next thing.
Hmm.
Please.
Hmm.
All right. Increased risk in cardiovascular issues.
Hmm.
So women need to be aware that during this phase and beyond, that beautiful estrogen was helping out, like we had talked about before,
Hmm.
with the cardiovascular system, and it's not doing its job as well anymore. So we have an increased risk of things going on with that. So you got to be mindful and stay up on all of your physicals for sure with that. Urinary issues, we talked about
Hmm.
UTIs. Weight gain we talked about, and one of the other health risks that you have to be aware of, especially in perimenopause, not necessarily menopause, is if you are having a lot of these symptoms and if you are feeling that they are progressing and getting worse, advocate for yourself, because there are such things as a prolapsed uterus, and other urinary issues that can cause problems from having a prolapsed uterus. And what that means is that the linings of the walls inside have been breaking down and getting so weak that, for lack of a better way,
They're
things are
falling out of you.
falling. Gravity is winning, and they are falling down and out. They're
Down and
trying to
out.
exit the building.
Hmm.
So those things can cause extreme discomfort and complications. And so they need to be addressed too. So advocate for yourself. If you feel like you do not feel well, things are not going right, things are drastically changing, keep talking about it, keep advocating, for sure. It's a necessity. So don't go silent into that argument.
No, go in there and say, I listened to this podcast
They told me
and they are nearly normal and they told me this is not normal.
this is not nearly.
So if they're saying it, it must not be normal.
That's right. That's right. Um, and then real quick, you'll talk about treatments
Sure.
for those things. Okay. So you've been doing a lot more research on this lately, which I love, in terms of some of the different treatments. And because we had talked about this before a couple
Hmm.
times, but so there is hormone therapies that
Hmm.
are available for women who are suffering from both perimenopause and menopausal
Hmm.
symptoms. You just have to find a provider who is open and willing to talk to you about those things. But there
Hmm.
are also places now that you can go outside of your typical providers.
Yes.
And so I think that's important to tell people as well.
Yes. There is a place actually that's local to us. They don't take insurance, but I think is one of the
Yeah.
much better places to go. So yeah, thinking outside the box of that. Like if you're not getting or not being offered, what you feel like is an adequate, treatment options, then seeing someone outside of like your gynecologist or your primary care, I think is absolutely
Yeah.
worth it.
Especially if you're having those conversations, and like we talked about, it's just not
Yep.
going anywhere.
Yep.
Um, or everything is told is to you is normal, and you feel like that's not true.
Yep.
There are behavioral therapies that can also be effective and helpful. If you are talking to a therapist, definitely talk about these symptoms openly. This is one of the a very big phase in your life that should be discussed in terms of mental health therapy, and because
Hmm.
it has all those mental health implications. And there are mental health medications that have been effective in helping to treat with some of these symptoms, and we use them with postpartum as well. So there are
Hmm.
medications that can help. They will help during cycles. They will help to try to compensate for what those estrogen and progesterone things are out of whack. They will try to compensate a little bit, and they have been helpful, and they will boost up the mood and try to pull down a little bit on that anxiety that's also happening during this time. So those can be helpful. Other behavioral changes, like we talked about, some dietary changes are helpful. Cutting back on caffeine, cutting back on alcohol, a little bit of the sugar, taking a little bit more of the sugars and carbohydrates out of your diet. So any of those things that would typically make you more healthy are things that would actually help you in this particular phase. And always getting more active, walking, exercise routines, anything like that also will help compensate during this time. Um, And then there's always like the hormone creams, which are also something that people often a little bit, I guess, more attainable for most people
Hmm.
to get. Like there are some creams that will help with either estrogen or testosterone. And those seem to be effective for some people as
A patch, and
well.
then you can also get testosterone pellets.
Okay. Yeah, you were telling me about those things.
Yeah, yeah, you get them like they're little like seeds, and you get them injected like in your butt, like in the muscle of your butt.
God.
Yeah.
Okay.
But then it's like kind of like
I didn't.
a an extended release kind of situation. And I don't know how often you get that, but
Okay.
that's also a thing.
Okay. Keep advocating until you find a provider that you feel is understanding you, and listening to you. And I think that's really important. I've changed providers a couple times, through my long journey with it. And then you finally find a provider, and then you feel like there's a good plan in place, and you know what you're doing, to get yourself feeling a little bit more healthy in this process and definitely more stable.
And I think, I don't know, for me, one of the things I look for in providers is not necessarily you're going to tell me the treatment that I want to get, but I think something about the way you present treatment options matters a lot, because you want a doctor that like thinks outside of the box, that isn't like it's this or too bad.
Mhm.
That's not really a great
That's
place
what
to
turns.
be. Yeah, so
Yeah.
I think if you have someone that's like, this is what typically works, here's some off-label things, here's another way, but you just, at the end of the day, it's not about presenting, a million options, but I think it's having someone that is able to kind of pivot and be flexible and thinks outside of the box.
Absolutely. Yeah. But keep advocating because these symptoms are real and they are lasting a long time and they are valid and it brings a lot of change and you're not doing anything wrong. And so,
And saying that's normal, it's just that's not good enough
no,
anymore.
absolutely.
That's, yeah.
No.
It's not normal for me. I think that's the takeaway is like when someone says that, you can say, well, that's great. This isn't normal for me.
Yeah. I know what I want my normal to feel and look like, and
Hmm.
that's what I'm striving for.
Right. And we got to get a little bit closer to that.
Yes.
We got to get nearly normal. All right, nearly normies. Until next time, stay nearly normal.